Good afternoon, everyone, and thank you so much for being here today in the State Room at the State House. And I'm pleased to be joined by our Lieutenant Governor, Sabina Matos, along with Dr. Nicole Alexander-Scott and Commerce Secretary Steffi Pryor and Tom McCarthy. And I thank all of them for their work over the last 20-some-odd months and also over the last couple days to really talk about the impending issues that we need to really work on. We're also joined by representatives of Rhode Island's medical community, including Tim Babineau and of Lifespan, Dr. Jim Finelli of Care New England, and along with Dr. Elizabeth Lang, Dr. Brad Collins, and Dr. Tiffany Collins. So thank you for your access over the last several days to talk about the things that are really important to you and the health care that you provide to the people in the state of Rhode Island. So we're also glad to have Dale Venturini from the Rhode Island Hospitality Association, Rick Simone from the Ocean State Coalition, and Chris Parisi from the Rhode Island Small Business Coalition. And the same to you. Thank you so much for having the dialogue that we've had over the last several days to really compare notes and to determine how we can really move forward in a way that's really important to the health of the people in the state of Rhode Island, along with the economy in our schools. I would just start off by saying there's pressure right now on our hospitals and the healthcare industry. There's pressure that could cause more pressure on our economy, and also, as a result, pressure on our schools. And now's the time to act. It's not a time to just sit and wait, and we need to make sure that we're doing things in a way that's collaborative, that helps the people in the state of Rhode Island as we get through another hurdle of this pandemic. Over the last 20 months, Rhode Islanders, medical professionals, business, and residents have worked together to keep ourselves, our families, and our community safe. I think it's nothing short of extraordinary. Before I was governor and since I've been governor in March, we've done a good job, and we've all done it as a team. Together, we've supported our small businesses by ordering online, picking up curbside, and various other things that Dale and the rest of the small business community have dreamed up and have been really creative doing that. We showed the spread by taking activities like yoga. You know, we slowed that spread by activities like yoga, gym classes outside, and we celebrated holidays and birthdays by Zoom. And then we stepped up to get Rhode Island vaccinated. Yesterday was one year anniversary of the first COVID-19 vaccine administered in Rhode Island. And since then, we've come a long way with our vaccination efforts. Today, over 76% of all Rhode Islanders have completed a primary vaccine series, and we're not stopping there. And I'll stop just a moment to thank the men and women who are on the ground, our first responders, municipal, FEMA, REMA. The efforts there have been extraordinary in partnering with the Department of Health and other departments in the state of Rhode Island. So we're going to bring the same momentum to our booster shot, because we know just how crucial booster shots are when it comes to keeping Rhode Islanders highly protected against the new variant. When I got my booster shot, it was kind of, oh, well, I'll get a booster shot. You know, it was kind of another safety measure. A lot has happened since then. A lot has happened since Thanksgiving. And so at this point in time, we need to really let people know in the state of Rhode Island that the boosters are important. And that one of the reasons that we got through the Delta so well was that we had the high vaccination rates. And we really didn't have to really do a whole lot other than really being conscious on it. We did answered the hospitals ask for a vaccine protocol for healthcare workers. But today, the booster is going to be critical, right? So we know that at some point in time in the next few months or next few weeks, that CDC is going to call that third dose of vaccine a fully vaccinated people will be fully vaccinated with that third dose, which has to do with the booster shot. Ahead of that, I had a call with municipal leaders this morning and asked them to continue partnering with the state to host local vaccination clinics. We want to ensure that Rhode Islanders have easy access to their boosters. And if you recall, that's what we did on the vaccinations. We took the work that was there, we added the municipal leadership in, and I think virtually every community was on that call with their municipal leaders this morning with myself, Tom McCarthy, along with Stephen Pryor, and our office. And I believe that they all will be following up with them to take us from right now where we can do about 50,000 shots a week right now, which we thought was adequate, but we need to build that back up to 100,000 shots a week like we did during the pandemic. And that's our goal, and that's our commitment. So again, if you haven't been vaccinated, please do so. But if you have been vaccinated, we want you to understand that the boosters are important to not only the safety and the health of the state of Rhode Island, but we also know that it's going to be important to our economy, and it's going to be important to our schools and having our students be physically in the classroom. From the beginning, we've had a whole government approach to responding to this pandemic. Together, as a team, we closely monitored the data, number of cases, hospitalizations, hospital capacity, and unfortunately, our death rates. And as we expected, because it is getting colder outside and more people are congregating inside, we've seen an increase of the COVID cases in Rhode Island, which has now brought us to this point where we need to address this issue head on. But this winter is different than last winter because of our national staffing crisis made worse by healthcare burnout, other contributing factors, job changes, career changes that are going on throughout all industries. The impact that the vaccination had, the protocols that we put earlier in the year, all our hospitals in Rhode Island are at a breaking point. And I've spoken repeatedly to our state's hospital leadership over the past few weeks. Personally, and through our staff, the Department of Health and others have had direct communication with our healthcare providers, hospitals, physicians, nurse associations, and the associated areas that are speaking on behalf of the healthcare industry. And we know when they reach out in this way that we need to respond. And they've made it clear that the measures we're announcing today are critical. That's why, because of the strain on our healthcare facilities, coupled with the rising number of COVID cases in our state, I'm announcing several temporary measures to bring additional layers of mitigation during the holidays when more time is spent gathering indoors. The measures fall on 3 categories and focus on masking and proof of vaccination. Category 1, indoor venues, including retail, entertainment venues, venues of assembly, and restaurants with a capacity of over 250 people. Inside these settings, masking will be required for employees and patrons, regardless of vaccination status. Category 2 involves indoor venues, including retail, entertainment venues, venues of assembly, restaurants, dance studios, gyms, all those areas that have certainly been impacted last year at this time when we had a pause. This is not a pause. We want to let people know that business is going to continue and that we encourage people to frequent our local businesses, but be safe about it. Inside of these settings with fewer than 250 people, masking or proof of vaccination will be required of employees and patrons. Category 3 involves office-based businesses and other public and private employers. We have many of our corporate businesses have really been very responsible, stood up and identified inside of their workplaces that are not have a public facing in ways that I think that we need to continue to support, and that's the reason why we have this category 3. Many of them have determined who's vaccinated, who's not vaccinated, have made that program and the protocol in their own businesses that require people who are not vaccinated to have a mask. And then people who are vaccinated in that closed setting are not to be wearing masks. So that means all office-based businesses and other public or private employers with indoor operations must require either a masking or proof of vaccination. These temporary measures will go into effect on Monday, December 20th, and will be reevaluated in 30 days after the executive order is signed, which I expect to do within the next 24 hours. Now, I'm sure since folks are seeing and hearing this for the first time, there are going to be some questions of how this will work. Questions like, will I have to show my actual vax card, or will a picture of my phone suffice? Our Commerce and Rhode Island Department of Health teams will be publishing frequently asked questions, document online by close of business tomorrow. Update signage for businesses will be available online at that time. And they're here today as well to do sidebars to answer the questions that may be asked. So just so you know, a person's actual vaccination card, a photo of the card on the phone, or using an app would be all acceptable to show proof of vaccination status. And as I've said, we've been talking to our counterparts in leadership in bordering states of Massachusetts as well as Connecticut. And Connecticut and our state will be rolling out a regional strategy on this system in terms of on-phone apps that will support this effort that we're involved in that right now today. Today's announcement is all about taking a comprehensive approach to address COVID-19 cases and alleviate pressure on our hospital systems while preventing economic disruption for our small businesses. So in addition to temporary masking and proof of vaccination measures, I'm also taking action to strengthen the state's COVID-19 testing strategy. First, I'm announcing that the state will distribute 100,000 at-home rapid COVID-19 tests over the next 2 weeks. Our health equity zones and community partners will support the distribution of tests to residents. Using these tests, Rhode Island will be able to test approximately 10% of its population over the next 2 weeks. I have also requested that an additional 1 million at-home rapid tests from FEMA, which would allow us to provide rapid tests to all 39 cities and towns. And second, I've asked the Department of Health to swiftly explore additional laboratory capacity to help reduce the COVID-19 PCR test result turnaround times. And third, I'm also announcing that Rhode Island will continue to expand Test to Stay. This initiative helps keep kids safely in schools and reduce interruptions of learning. Doubling down on that is going to help keep our students safely in schools, and it also will help relieve, as I talked to one of the hospital CEOs, when a child is at home, then a parent needs to stay with that child. And if they happen to be a healthcare worker, that only doubles down and makes it more difficult to manage. If it happens to be a hospitality worker, the same thing is true. Test to Stay will be expanded in these communities: Smithfield, North Smithfield, Barrington, Tiverton, Blackstone Valley Prep, and the learning community in Central Falls. And we're going to be encouraging more and more school departments to make sure that they adopt this Test to Stay as part of our overall comprehensive plan. And we're fortunate to have done the pilot work in Westerly a few weeks back, that in that short time frame, just for people out there to kind of support it, ask your school district to do it, 350 days of school time was saved in just a 3-week time frame. You put that across the whole state of Rhode Island, thousands of days of school days will be saved by putting Test to Stay in all 39 cities and towns and the districts that are in those communities. So before I turn it over to Dr. Alexander Scott, I want to share the steps my administration has taken to address workforce challenges across Rhode Island's hospital systems in particular. We have them across all different sectors, but today we're talking about hospitals, but we intend to continue the discussion on the work shortage in Rhode Island, and all industries. Will start with the healthcare system, and which is our priority right now. Today I sent a letter to FEMA to request FEMA medical personnel to assist the state's response to the recent increase in COVID-19 cases and hospitalizations. Specifically, I'm asking for emergency staffing from FEMA for local hospital systems. The Rhode Island Emergency Management Agency is currently working with hospital leadership to complete the formal FEMA resource request process. And finally, I will be forming a governor's working group on healthcare staffing capacity. The group will be made up of both state and private sector leaders in the healthcare and workforce sectors to explore additional short and long-term solutions to address the healthcare staffing challenges facing Rhode Island. I'll have more to say about this next week. I want to end with talking to the people of the state of Rhode Island. We don't know what's around the corner. We only can address what we're dealing with right now. And that's exactly what we're doing. Just as we've had throughout the entire pandemic, during Governor Raimondo's administration and now my administration. We continue to try to be honest with people and let them know what's going on. We also know that the overwhelming majority of the people of the state of Rhode Island, you can just see by the response on the vaccines alone, have responded in a way where they want to help their communities, not only their health, their economy, and the schools. They've done it in a way they've stepped up each and every time. I'd ask the same thing I asked of the municipal leaders today. We need your help to make this all work. We need to make sure that it's a positive response in the community, as it has been throughout the state. We're trying to factor in everything that we possibly can to make sure that we're addressing as many issues as we possibly can with the least amount of restrictions that we were, that put in place in the state of Rhode Island. But we must remain vigilant, rally together, and in doing so, we will be able to flatten this curve that we're currently dealing with, alleviate stresses on our hospital systems, and then these executive orders. The sheet of executive orders have been reduced down to one sheet. We were in a process of actually ramping down the COVID rate a week before Thanksgiving. But we have to react to what's in front of us. Infection rates are rising. We know that there's a variant that we need to deal with. We're going to need your help to deal with it. If you have suggestions on how we can do better, bring it on. We're very happy to listen to anybody out there that's impacted in a way on these issues.